About Chapter 2, Conception and Genetics. Of course, this is human growth and development, and since it's human growth and development, we have to talk about how people are conceived, how individuals are conceived. So let's go ahead and get started. This is kind of a dark chapter, and the reason is because we're going to talk about some of the problems you can have in uh, impregnating conception genetics, some of the problems that they have. Most of these are very, very rare occurrences, but they do occur, and because they do occur, we need to talk about them. And if I can get this thing going, there we go. Okay, conception and genetics. Chapter 2. Conception takes place when a single spermatozoa combines with a single ova in the woman's fallopian tubes. Now, to say it only takes one sperm is true, but it's kind of not true because in order for a sperm to be able to invade, to be pulled into an ova, they need to break. It needs to break down the outside of the ova, and this takes several 100,000 sperm trying to break through. A woman is born with all the ova that she will ever have, about 400,000. In most months, a woman will only have one viable ova available for fertilization, and that's the way it normally works. The man will ejaculate as many as 1 billion sperm, and this is the number is going it's actually going down. When I first started in working in medicine, the number a normal sperm count was about 360 million per mil. A male can ejaculate as much as 10 cc's or 10 mils of semen in an ejaculate. So it all depends on the volume. It all depends on the sperm count. So it was like 350 million per mil before. Now it's closer to 175 million, and we're not exactly sure why sperm counts are going down. But it does seem to happen. There are select things that can happen. The environment, a stressful life can lower your sperm count. Um, marijuana, smoking tobacco, drinking alcohol, all of these can lower your sperm count using drugs of one kind or another. So we're not exactly sure what's happening, but it seems to be that the average sperm count in the United States, in the world, is going down, and no one's quite sure what's happening. A man will ejaculate, and so, yeah, if you've got a very voluminous ejaculate, then potentially you could ejaculate 1 billion sperm. Do you need 1 billion sperm? No, probably not. But you need several 100,000 to make it all the way to the ova in order to impregnate that ova. Now, the thing about the female, of course, women are born with all of the ova that they will ever have, but males are continuously manufacturing sperm. This is just the way it is. Some figures, depending on the health of the individual, the numbers can be as high as 37,000 per second. That's how many sperm the individual is manufacturing. And that all takes place in the testicles, of course. Hundreds of millions of sperm are produced in the testicles of most males every day. Each male ejaculation into the female vagina deposits hundreds of millions of sperm. However, unless the woman is ovulating, the cervical opening is closed and won't allow the sperm to enter the uterus. Since the sperm cannot enter the uterus, they cannot find their way to the fallopian tubes. When ovulation occurs, the mucoid plug that protects the cervix becomes more liquid, allowing the sperm to enter the uterus. Fertilization is most likely to occur if intercourse takes place on the day of ovulation or the 5 days before ovulation. While almost all births are of one child, sometimes women will give birth to 2 or even 3 infants. There are 2 ways a woman can have more than one child. In two-thirds of all twin births, a woman will produce more than one ova, usually from each fallopian tube, and each ova is fertilized and forms a zygote, another name for a fertilized ova. These twins would be referred to as dizygotic twins and would commonly be called fraternal twins. Dizygotic means two zygotes. Sometimes the single zygote will split and form two identical zygotes. These twins are referred to as monozygotic twins and would be commonly referred to as identical twins. Twin birth rates in the United States is about 3.3%. For the white population, it's about 3.8%. For the black population, it's about 3.7%. For the Hispanic population, it's about 2.2%. And these are dizygotic twins, obviously. These are the Bush twins, George W. Bush's daughters. And she's on television now, I think. And these are dizygotic twins from Amsterdam, from Holland. And there are the two babies. There's what the mom and the dad look like. One just has darker genes than the other. And there they are later on. The dad is out of the picture at that point. There they are as they get older. And these are the Aylmer twins from London. As you can see, they look as if they are different races. Of course, this would create a really interesting debate as to what race these select individuals are. Obviously, they're from the same uterus. So would they, and the mother and the father are exactly the same. So would you say that one was white and one was not? And the answer would have to be, wow. See, this is a debate that is really quite confusing. And these are the Aylmer twins, both wearing Chuck Taylors. Their shoes. There's one black and the other white. Monozygotic twins, these are monozygotic twins, so they're identical twins. It is estimated that between 8% and 17% of U.S. couples are unable to conceive. They experience infertility. The most common cause of infertility in men is a low sperm count. A normal sperm count ranges from 40 to 300 million sperm per mil of semen. Any count below 40 million sperm per mil leads to questionable reproductive capacity. Another problem that a man may have is sperm that are abnormally shaped and thus don't swim adequately to reach the ova. A far more rare occurrence is for there to be a genetic basis for the infertility. Normally it's just a low sperm count. Men who are having problems conceiving, impregnating their wives, they're told to wear cooler shorts, boxer shorts instead of briefs. That keeps the testicles a little bit cooler than it would if they were wearing tighter underwear, as weird as that all sounds. So this is huge. I mean, that's a really large difference between the two. And as I said, when I first started in medicine, and strangely enough, this is one of the jobs that I had, was doing sperm counts. I didn't have to do that many of them, but it's not a whole lot of fun. It takes quite a while. Normal was closer to 350 million sperm, and anything below 150 million was considered low, a low sperm count. Now they've lowered that to 40 million sperm per mil. So there you go. This is what sperm look like when you look at it under a microscope. As you can see, this is where the genetic material is. This chunk right here, that is a power pack that allows the tail to flip, and this, of course, is the tail. They look like little tadpoles. This is what a normal sperm looks like. It's the right size head, the power pack, and the tail, of course. And these are all abnormal sperm. So one of the things that I would have to do when I received a sperm count, the first thing I'd have to do would be to check motility. And so I'm looking at a specimen, and I'm seeing how many of them are swimming. How many of them aren't swimming? That's the most important thing. And you have to take a certain section and you have to count them, and you say, well, I've got 70% motility, which isn't too bad. It's usually higher than that with a normal sperm count. It's usually closer to 80 to 90%. As you can see, if you have more than one head on the sperm, it's going to be pulling in two different directions. If you have two different tails for one head, it's going to also be trying to swim in the wrong direction. This is a head that will not impregnate anything. This is one that is befouled. This one is not going to function either, and neither is this one. You can see how large the power pack is. It's got to be perfect in order for it to work. Reproductive problems with women often include problems with producing or transporting ova. Abnormal ova can also be a cause. Excessively thick mucus covering the cervix may also be a problem. Problems with the health of the uterine wall will prevent implantation. For women over 30, the problem may be deterioration of the quality of the ova. However, the most common problem preventing women from becoming pregnant is blockage of the fallopian tube. Over half the time, it is due to STIs, sexually transmitted infections. I knew an individual who had their fallopian tube was adhesed to their colon, and that caused a kink in the fallopian tube, and it wouldn't allow the ova to pass through, and it was impossible for her to get pregnant. Eventually, she had the fallopian tube pulled off of the colon and straightened out. And the first time she tried to get pregnant, she had an ectopic pregnancy. Ectopic pregnancy is where the zygote gets stuck in the fallopian tube, and it grows and grows and grows until it ruptures the fallopian tube. So she lost a fallopian tube the first time she tried to get pregnant, and then she was afraid to try to get pregnant again. Eventually, what happened was that she harvested her ova, and she was able to get pregnant by implanting her own impregnated ova into her uterus. Heredity is transmitted through a substance known as deoxyribonucleic acid, also known as DNA. An individual's DNA is a combination of their mother's genes and their father's genes. DNA is made of a combination of 4 amino acids: adenine, thymine, cytosine, and guanine. An individual's genetic code is a series of 3 billion pairs of these 4 amino acids. The largest unit of hereditary structure is the chromosome. There are 23 pairs of chromosomes, a set of 23 from the sperm and a set of 23 from the ova, for a total of 46 chromosomes. So as humans, we have 46 chromosomes. If we look at dogs, we look at cats, we look at antelope, they have different numbers of chromosomes. And it's one of the reasons why a human can't impregnate a cow, or why a human can't impregnate a gorilla. It's because they have different numbers of chromosomes and it wouldn't match up. Chromosomes are constructed of genes, about 30,000 in each cell. One cell will contain a full strand of DNA, so each gene will be a segment of DNA. And this is one of the reasons why you can identify somebody by their DNA. Everybody's DNA is unique. Every cell in their body has exactly the same number of, the same structure of DNA. Therefore, we can identify somebody from their DNA, even if it's just one hair cell, or it's one flake of skin. We can still identify who they are as far as their DNA is concerned. 99.9% of the genes in any human's body are identical to all other humans. In other words, your DNA and my DNA are almost exactly alike. And this is one of the reasons why we can check people's DNA to determine who they are, because the vast majority of your DNA is the same as mine. So we don't have to look at all those billions of cells. We don't have to look at all of them. We only have to look at 0.1% of the cells in the DNA. These genes are known as monomorphic genes, or one structure. Monomorphic having to do with the 99.9% of genes that all humans have. 0.1% are different for each individual. And these genes are known as polymorphic genes. And this is what we're looking at. We're looking at the polymorphic genes. So when they're talking about identifying somebody by their DNA, this is what they're talking about, the 0.1%. The chromosome that determines if an infant is going to be male or female is the 23rd chromosome, or the sex chromosome. And, oops, I'm sorry, we saw it right here. This is the sex chromosome right here. There's 22 other ones. This is the sex chromosome. All cells in the body carry 46 chromosomes except an individual's ova or their sperm. Each ova and sperm have 23 chromosomes, and when they get together, they deliver half of their genetic material from the father and half from the mother. All ova are female or carry an X chromosome. The male determines whether the offspring will be male or female. When a male Y or a female X sperm breaks through the wall or is drawn into the ova, and this has been people are getting really strange about this. So if it's a female, this is what it looks like. A female has 2 X chromosomes, and one chromosome is exactly the same as the other. If it's a male, the X chromosome is much larger than the Y chromosome. It's about 70% larger. So if there's a flaw on the X chromosome, with another X chromosome, it will probably cancel it out. But if it's a male, then potentially it will not cancel out the flawed genes on the X chromosome of the mother. Okay, the male and the female chromosome are actually shaped like X's and a Y, and because of this, several abnormal genes found on the X chromosome will not be canceled out by the genes on the missing arm of the Y chromosome. These are known as sex-linked diseases, and they include such things as hemophilia, color blindness. Hemophilia is a blood clotting problem where the individual is missing a factor in their blood clotting, and therefore if they get cut, they bleed excessively. Color blindness, of course, you can't tell the difference between, it's usually red or green, but it can also be blue and yellow. I had I had a student once who was he was monochromatic. In other words, he could only see one color. Everything was shades of gray. He was really kind of interesting. He was the only person I've ever met who was so colorblind he couldn't tell any colors at all. And male pattern baldness, of course, is another problem that individuals have that they get from their mother. X and Y chromosomes. And as you can see, as we saw before, the Y chromosome is much, much smaller, about 70% smaller than the X chromosome, the Y. Dominant and recessive inheritance. Dark hair is dominant and blonde hair is recessive. Normal hair is dominant, but pattern baldness is recessive. Curly hair is dominant, but straight hair is recessive. Non-red hair is dominant, and red hair is recessive. Widow's peak hairline, that's where the hairline goes up into the scalp. Widow's peak is dominant, but the rounded hairline is not. Now, if you look at your brothers and sisters, or if you look at your brothers, American Indians tend to have a rounded hairline. But if you look at the Europeans, a lot of times they will have a dip in their hairline so that it looks more like a W. Facial dimples are dominant and no dimples are recessive. Normal hearing is dominant, thank goodness, and some form of deafness is recessive. Normal vision is dominant and nearsightedness is recessive. Farsightedness is dominant and normal vision is recessive. Normal vision is dominant and congenital eye cataracts are recessive. Normal color vision is dominant and red-green blindness is recessive. Pigmented skin is dominant and albinism or lack of pigment is recessive. Double jointedness is dominant and normal joints are recessive. Broad lips are dominant and thin lips are recessive. Arched Roman nose is dominant and straight noses are recessive. Extra fingers and toes are dominant, strangely enough, and 5 fingers and toes are recessive. Short fingers and toes are dominant, and normal length fingers and toes are recessive. Immunity to poison ivy is dominant, thank goodness, and sensitivity to poison ivy is recessive. Now that's really kind of interesting because I have 5 brothers and sisters, and only one of my sisters was sensitive to poison ivy. The rest of us, we could pull it, we could do anything we wanted with it, and we never got any blisters. But all she had to do was get anywhere close to it, and she just broke out in hives. Type A blood is dominant, and type O blood is recessive. Type B blood is dominant, and type O blood is recessive. Rh positive blood is dominant, and Rh negative blood is recessive. American Indian blood types. Okay, American blood types. I'm sorry. Whoops, I'm sorry. Okay, Caucasians, about 37% of Caucasians have O positive blood. For African Americans, it's 47%, so O positive is very dominant. Hispanics, 53% O positive blood, and Asians, 39%. And then, as you can see, we can break it down. A positive, 33% for Caucasians, 24% for African Americans, 29% for Hispanics, 27% for Asians. B positive, 9% Caucasians, 18% African Americans, 25% Asians. So as you can see, you can break it down. Each parent contributes half of the genetic material, and each will match up to determine hair color, eye color, etc. Each parent contributes half of the material for each characteristic. Thus, for each characteristic, an individual will receive 2 alleles. When both parents contribute the same allele, such as 2 blue-eyed alleles, the characteristic is said to be homozygous. If the 2 characteristics are different, then they are said to be heterozygous. In a situation where there are heterozygous traits, some characteristics will be dominant and some will be recessive, while still others will be blended. Skin tone tends to be blended. Hair color tends to be dominant. It tends to be one or the other. Eye color, it's rarely blended. It's never blended. You either have blue eyes or brown eyes or some shade of blue. Green is a shade of blue, is considered a shade of blue, as is gray and hazel. I'm not exactly sure what hazel is anyway. When looking at genetic structures, it's easy to see what traits are dominant. The observable traits that are created from dominant inheritance is known as an individual's phenotype. The hidden, possibly recessive matching structure is known as the genotype. Now, this probably doesn't mean a whole lot to anybody except for somebody who's cross-matching blood. And when you're cross-matching blood, you cross-match O positive, and you're looking for the Rh factor. You're looking for anything that might interfere with somebody else's blood type. So the phenotype is fairly obvious, but we also have to look at the genotype because sometimes the genotype will cause a reaction. So when we're cross-matching blood, very important as to the phenotype. And if we are doing that, we need to look at the genotype as well. This is also important if we are trying to match organs, if we are trying to find an organ donor. So we not only have to look at the phenotype, but the genotype. And this is one of the reasons why it's so difficult to find somebody who we can trade hearts with, or somebody we can get a kidney from. All of these things have to be looked at, the genotype, especially the genotype. The phenotype is fairly obvious. You're O positive, I'm O positive, we're good to go. Well, maybe not, because your genotype may be different than mine. And if I get your kidney, your genotype will cause a reaction, and I'll lose your kidney. With the thousands of genes and billions of combinations of amino acids that must go together, it may seem surprising that any normal children are born at all. But the reality is that any genetic flaw or outrageous abnormality that will not sustain life usually terminates long before the infant is due, usually within the first trimester. And this is one of the reasons why almost all miscarriages occur in the first trimester. However, there are some instances of sex-linked inheritances and mutations that produce offspring that may have some serious problems that will eventually lead to death. These are some of the birth defects from chromosomal abnormalities. Antitrypsin deficiency causes liver problems. Alpha thalassemia causes severe anemia, causing infant death. Beta thalassemia, severe anemia, causing teen death. Cystic fibrosis, this is common among Caucasians. They have too much mucus, and this causes a lot of problems. Duchenne's muscular dystrophy is a male degenerative disease. Hemophilia is usually a male bleeding problem. Anencephaly means their brain tissue does not develop properly, and it causes infant death. Spina bifida, the spinal column doesn't close up properly. Phenylketonuria, digestion failure causing intellectual disability. Polycystic kidney disease is a serious kidney problem causing death. Sickle cell anemia is deformed red blood cells in Africans. Tay-Sachs disease is a degenerative disease of nerve cells in Ashkenazi Jews. Now, you may ask yourself, well, what? I thought all Jewish people were the same. And the answer is no, there's two different diasporas. There are two different groups. One are Ashkenazi Jews. They mostly lived in Eastern Europe. And then the Sephardic Jews lived mostly in Spain. So if somebody claims to be a Sephardic Jew, it means that they probably have a Spanish name or a Portuguese name. The Ashkenazi Jews, they usually have German names or Russian names. 1 out of every 12 African Americans carries the sickle cell anemia trait. Sickle cell anemia, of course, I talked about this in another class. Sickle cell anemia has to do with malaria. Because Africa was, malaria was endemic there. There was so much malaria. The only way that humans could survive was to develop this, the sickle cell trait, and it causes sickle cell anemia, which usually leads to death for the person that's suffering from sickle cell anemia. But the individual that has a trait is actually protected from severe malaria, so they can survive. Now the interesting thing is that people in the United States, there's not that much malaria in the United States, only along the deep south, in the swamps of Texas and the Delta area of Mississippi, along the coast in Alabama and Georgia. So there wasn't that much malaria, but individuals do have the trait, obviously. 1 out of every 12 African Americans carries a sickle cell anemia trait. 7 out of every 10 African Americans, about 70%, will have a milk intolerance, a lactose intolerance, as adults. So if you're ever around someone who's African American, there is a possibility that they are lactose intolerant. 1 out of every 10 African American males has a hereditary predisposition to develop hemolytic anemia after taking sulfa or other drugs. And we discovered this during during the Korean War. They were giving people sulfa drugs en masse. Anybody that was wounded, that was the treatment of choice. And what we discovered was about 1 out of every 10 African American soldiers that we treated with sulfa drugs developed this hemolytic anemia, and it's very deadly. So we had to change the protocol as far as antibiotics were concerned, especially for African Americans. 1 out of every 50 African American females has a hereditary predisposition to develop hemolytic anemia after taking sulfa drugs or other drugs. Now, the thing about the sulfa drugs are antibiotics. We don't use sulfa drugs very often, but there are some things that we have to use sulfa drugs on. That's the only thing that will knock them out. And one of them is select parasites. So this is something that we don't have to worry about as much anymore because we have broad spectrum antibiotics that aren't based on sulfa. So we do have something to treat just about everybody. 1 in 25 whites are carriers of the gene for cystic fibrosis. 1 in 80 whites are carriers of phenylketonuria, or PKU. 1 out of every 100 Ashkenazi Jews are carriers of Tay-Sachs disease, and this is also known as familial dysautonomia. 1 out of every 10 Italian Americans and Greek Americans will carry genes for beta thalassemia. That's an anemia. 1 in 45 Armenian and Sephardic Jewish individuals are carriers of familial Mediterranean fever, and this is also known as Cooley's anemia. If you're wondering, Armenian, who are those individuals? The Kardashians are Armenian. Afrikaners, or white South Africans of Dutch and English extraction, have a 1 in 330 chance to have porphyria. Porphyria is a genetic abnormality where the individual is unable to process oxygen from the red blood cell in select organs or organ areas such as their skin and their nervous system. Almost 100% of Asians are unable to digest milk as adults, and this is known as lactose intolerance. Almost 100% of American Indians are unable to digest milk as adults, also known as lactose intolerance. In most cases where there is an extra chromosome, the zygote would not survive due to severe abnormalities. However, when there is an extra sex chromosome or even a missing one, the individual will develop but have select sexual problems. The XYY is a tall male with slightly lower IQ and poorer verbal skills. XXX, the triple X, will develop as a female. They will have menstrual irregularities, and they tend to have intellectual deficits. The XXY, also known as Klinefelter syndrome, will be a sterile male. They have few sexual characteristics, learning problems. XOs are known as, this is known as Turner syndrome. This is a short, sterile female who will have incomplete development. Fragile X is a broken arm on X chromosomes, causing intellectual deficits that are more severe in males. 3 other chromosomes of the 23 pair can have an extra chromosome or trisomy. The most common case of extra chromosomes is trisomy 21, better known as Down syndrome. In Down syndrome, the individual may have a mild to severe intellectual disability with various organ and physical malformations. The second most common trisomy is trisomy 13. In trisomy 13, the infant is born with multiple nervous system, organ, and facial malformations. 72% die before they are 1 year of age. Trisomy 18 is less common, but also results in more terminated pregnancies due to fetal death. In trisomy 18, the infant is born with severe nervous system, organ, and facial malformations. 90% will die before they reach the age of 1 year. Researchers are discovering, and these are all quite rare. Well, not Down syndrome is not that uncommon, but trisomy 13 and trisomy 18, relatively uncommon. I used to work in a children's hospital in Omaha, and we saw these, and we were getting all of the children from we were in Nebraska. We were getting everybody from South Dakota, southern South Dakota, all of Nebraska, the western half of Iowa, and the northern half of Missouri. And we didn't see these very often. I think I saw maybe 5 or 6 of each of these while I was working there, and I only worked there for a couple of years. Researchers are discovering a great deal of information by studying groups of monozygotic twins. Interestingly, even when the twins come from the same zygote, in 1/3 of the cases, each embryo will create its own chorionic sac. By comparing these twins with dizygotic twins and monozygotic twins that were separated at birth, researchers are getting a new understanding of the impact of the environment on the human personality. Neither heredity nor environment work separately to come up with a final human product. The reaction range of an individual is a combination of environmental factors and hereditary traits to come up with a final human product. For example, when discussing height, an individual may have a height reaction range between 6 feet and 7 feet. With optimum food and exercise, the child will reach a height of 7 feet. Without it, he will end up somewhere in between. However, there are some hereditary traits that can rarely be changed by the environment, such as your eye color, and this is known as canalization. No matter what your environment is, your eyes are still going to be exactly the same color. There's nothing you can do about eye color. Genotype environment interaction refers to the interaction between the same environment on individuals with different genetic makeups. The classic example is looking at allergens in an area and seeing which children become allergic to them. It also refers to the individuals with similar genetic makeup growing up in different environments. The classic example is a child who has trouble in one family environment but thrives in another. Let's see if this actually works. The answer is yes. I don't have any noise. Oh, great. Oh, wait a minute. Skip ads.
Here's your tea, Mother.
Oolong?
Yes.
Loose, not bagged?
Yes.
Steeped 3 minutes?
Yes.
2% milk?
Yes.
Warmed separately?
Yes.
1 teaspoon sugar?
Yes.
Raw sugar?
Yes.
It's cold.
I'll start again.
I have the same problem with him. My theory is that his lack of focus stems from an overdeveloped sex drive.
Oh, I don't know where he would have gotten that. Aside from a pro forma consummation of our marriage, his father and I only had intercourse for the purposes of reproduction.
That seems a fairly efficient arrangement.
Yes, we think so. We've both done papers on it. Mine from a neuroscientific point of view and his from an anthropological. Mine, of course, was the only one worth reading.
Of course. I would very much like to read about your sex life.
Well, it's all online, or you can order it from the Princeton University Press.
Here's your tea, Mother. So, what are you guys talking about?
The frequency with which your parents had intercourse.
Well, if you're lucky, maybe she'll show you the PowerPoint presentation.
I'm sorry, it's on my other laptop.
So, Mother, what's new?
You'll have to be more specific.
All right, what's new with you?
Oh, well, I've been having some fascinating menopausal symptoms recently.
Maybe something less personal.
Oh, your Uncle Floyd died.
Oh my God, what happened?
His heart stopped beating. I have to urinate.
What a remarkable woman.
Yeah, I thought you guys might hit it off.
I envy you your childhood.
I hate to tell you, but the only warm memories I have of my childhood are of my Uncle Floyd.
But you're clearly misremembering. Your mother is brilliant, analytical, insightful, and I'm betting she never hit you with a Bible because you wouldn't eat your Brussels sprouts.
Sheldon, you don't give your mother enough credit. She's warm, she's loving, she doesn't glue electrodes to your head to measure your brainwaves while potty training.
You were lucky. Yeah, when I was a kid, if I wanted an EEG, I had to attach my own electrodes.
There's one simple hearing hack anyone can use to improve their hearing
No, let's
almost
not do
overnight.
that. There we go. Okay. When the environment reinforces genetic differences because they work in the same direction, it is known as a genotype environment correlation. There are ways that this can happen. Passive correlations, parents that give the traits to their children also tend to maintain an environment that encourages the development of that trait. Reactive or evocative correlations, children with different traits will get different reactions from parents. Active correlations, as children get older and are allowed to select their own activities, they will gravitate toward activities that they have a genetic proclivity to perform well. Not surprisingly, children who grow up in the same family often have very different personalities, IQs, and interests. This is due to the fact that children born at different times in families cannot have the same experiences. This is known as non-shared environmental effects. These include the differences between boys and girls, composition of the family, the historical impact of what is going on in a family. Geneticists feel that similarities between siblings is probably due to genes, while differences are due to non-shared environmental effects. A good example would be when a couple first gets together, the father starts working, they have a child, they have a select amount of money. But as the father continues to work, he's making more and more money. More children are coming. So with the first child, of course, they don't have enough money to give that child everything that they want. By the time the last child arrives, the father's making enough money where that child tends to be a little bit more spoiled because the father has established himself in the work environment. Um, so, that's one way to look at it anyway. Physical attributes such as height and weight, intelligence, general intelligence, and specific abilities are influenced by your genes. Enriched or impoverished environments will make or break a proclivity, but native intelligence levels tend to be closer to biological parents than adoptive parents. Personality studies of 5 major groupings of personality traits shows that there is heritability of about 40% of your personality. The big 5: extroversion, neuroticism, whether you're overly anxious or not, how conscientious you are, agreeableness, and openness to new experiences. Kind of interesting. If you look at my own family, there were six kids in the family. Most of the kids stayed pretty close to home, but the 2 middle children, my sister and I, we moved the farthest away. And of course, I've been moving all over the world since I graduated from college. And she moved to Chicago, which is like we grew up on a farm in Indiana, and she moved to Chicago to enjoy the city life. As far as the rest of my brothers and sister are concerned, they stayed pretty close to home, and were supported by my parents more because they had, my parents could babysit, they could take care of, help take care of of whatever was happening. But of course, I was in Germany, I was in Texas, I was in Nebraska. I was all over the place, so they couldn't help nearly as much with me or my sister who lived in Chicago because she was that far away. Select studies have shown that other personality traits may be influenced more by the heredity than environment, such as your temperament, your activity level, your sociability, your emotional level, and your shyness. Now, it's really kind of curious because my mother was pregnant with my oldest sister during the war, and my father was overseas. He was during World War II. My father was overseas, and my mother was a little afraid. She was afraid that that my sister there was something wrong with her because she hardly ever moved. And then after she was born, she still didn't move very much. And all of her life, she disdained movement. It wasn't that she was large; she wasn't large at all. Actually, she was quite slender, but she just hated moving, and she never ever did that. She didn't move nearly as much. Um, I ran track. My brother played. We all played baseball. You know, everybody else moved around, but she never did. My mother disliked me the most of all of her pregnancies, mainly because I moved so much inside. She was afraid that She claimed that. What did she say? She said I was the one that destroyed her gallbladder because I kept kicking her in the ribs. Anyway, not important. Psychopathology, there seems to be a strong genetic influence on at least two forms of psychopathology. Schizophrenia, loss of contact with reality marked by episodes of delusions and hallucinations. The risk of developing schizophrenia is 10 times greater among siblings and offspring of people suffering from schizophrenia than in the general population, with an estimated genetic contribution between 63% and 85%. Autism is the other psychopathology that is potentially genetic. It is a disorder marked by an inability to have normal social interaction. The individual has impaired communication and impaired imagination. Children suffering from autism often develop obsessive ritualized routines and may display repetitive movements that can be destructive to the individual. Gestation for humans averages about 266 days or 9 months. Gestation is the length of time from fertilization to the emergence of the offspring from the womb. Prenatal development takes place in 3 stages. In the germinal stage, the growing structure is called a zygote. The next stage is the embryonic stage, and the growing structure becomes an embryo. The stage before birth is the fetal stage, and the growing structure becomes a fetus. As the human grows from a zygote to a child, they develop in 2 directions: cephalocaudally from the head down, and proximodistally from the near to the far. In other words, they develop from the inside out and from the head down. And there you go. As you can see, the head is much larger here. Whoops, I don't have an arrow. Wait a second. Let me get my arrow back. There we go. This head is much larger than this head as compared to the body. Cephalocaudal. The germinal stage lasts from fertilization to about 2 weeks. The structure is known as a zygote. At the 36-hour mark, the zygote begins rapid cell division through mitosis. By the 72-hour mark, 3 days, the zygote is 16 to 32 cells. At this point, the zygote is making its way down the fallopian tube to the uterus. By the 4th day, hopefully the zygote is floating free in the uterus. If the zygote gets stuck in the fallopian tube, it will grow until it is too big for the fallopian tube, and it will cause the fallopian tube to rupture. And this is what I was talking about before. This is a condition known as an ectopic pregnancy. Select cells will develop into the structures that will protect and feed the developing embryo. Placenta is the protective sac. The umbilical cord through which the embryo will be delivered oxygen and nourishment. The amniotic sac is a fluid-filled membrane that protects the developing fetus. The chorion is the outer membrane of the amniotic sac. The trophoblast is the outer layer of the blastocyst that produces thread-like structures that penetrate the lining of the uterine wall, attaching and allowing it to tie into the mother's circulatory system through the umbilical cord. And there's what a baby looks like growing in its mother's uterus. And that's the size of it, 8 to 9 days. It has to grow into the uterine wall. If it doesn't grow into the uterine wall, it has no way of getting any nourishment. It is estimated that only 10 to 20% of fertilized eggs ever implant on the uterine wall. This task must take place before the 8th to 10th day of gestation, or the zygote's chances for survival decline rapidly. The embryonic stage runs from the 2 to 8 week gestation period. During this stage, the developing child becomes an embryo. The organs and the major body systems develop rapidly during this period. The embryo is quite vulnerable to destructive influences. The nervous system develops between the 2nd to the 5th week. The heart develops between the 3.5 to 6.5 week mark. The arms develop between the 4.5 to 8 week mark. The eyes develop at between 4.5 and 8.5 weeks. The legs develop 4.5 to 8 week mark. The teeth develop between the 7th to 9th weeks. The palate develops between the 7th and 11th week. The external genitalia develops between the 7.5 to 11 week mark. And the ears develop at between 4.5 and 9.5 weeks. If something horrible happens in those time periods, potentially there will be a problem with that structure. Unless an embryo is perfect, it will probably not survive the first semester. If this is the case, an embryo will be spontaneously aborted or miscarried. Between 50 to 70% of miscarriages are due to chromosomal abnormalities. More miscarriages occur to male embryos than to female embryos, and we all know why that is. It's because the X chromosome and the Y chromosome don't match up very well. So there is a greater probability of there being a abnormal chromosomal abnormality if there's a problem on the X chromosome. 56% of all conceptions are male, but only 51% of all births are male. At the 8th week or 2 months mark, the developing child passes into the fetal stage and becomes a fetus. This stage is marked by the first development of bone cells. During the fetal stage, the growth rate of the fetus accelerates rapidly. The fetus marks the beginning of movement or quickening. Movement and fetal growth are normally monitored through ultrasounds. Males will differentiate themselves as early as the 8th week, as they will be more active than females. And there we go. Beginning at about the 12th week, a fetus will begin swallowing its own amniotic fluid. Amniotic fluid is the waste products of the fetus. The swallowing stimulates the fetus's sense of smell and their sense of taste. By the 14th week, mature taste cells have appeared. If the mother has ingested a food of flavoring that crosses a placental barrier, the fetus will be tasting it over and over again. Alcohol is one of the chemicals that readily crosses a placental barrier, and this may be one of the reasons why, if a mother drank during her pregnancy, that an individual will develop a taste for alcohol. It's also the reason that they develop a taste for oregano, for any of the spices that a culture uses on a frequent basis. My children both have an affinity for pickles and for peppers, and that may be because my wife consumed a lot of pickles and peppers while she was pregnant, especially cherry peppers. She really liked cherry peppers. Okay. Oh, there we go. We're growing. We're growing. Third month, fourth month, fifth month, sixth month, seventh month, eighth month, and ninth month. This time I want you to watch the breast. You can see how the breast changes over time. How the areola gets darker and larger. For a lot of women, they detect that they know that they're pregnant because their breast changes. Its shape and the nipple darkens. That's the areola. Okay. Anyway. And the baby's growing, the baby's growing, the baby's growing, the baby's growing. The study of chemicals or substances that might affect a developing child is very complex. If the mother is exposed to a chemical or substance during a critical period of development, when a select organ is being formed, the dangerous chemical or teratogen may cause irreparable damage. Any other time, an exposure will do very little to no harm. One of the most critical aspects of pregnancy is the need to increase calorie intake, especially protein. It is estimated that women need to increase calorie intake by 300 to 500 calories a day. Women who gain between 22 and 46 pounds during pregnancy are less likely to miscarry or have low birth weight babies. Research shows that malnutrition during fetal growth can have lasting effects on the offspring. A Dutch study showed that prenatal nutritional deficiency in the second and third trimester resulted in increased antisocial personality disorder. And this was during the Nazi occupation during World War II. The placenta tends to protect the developing fetus from select poisons that the mother might ingest or come in contact with. However, there are some chemicals and medications that do cross the placental barrier. One is tetracycline, which is an antibiotic, Accutane, which is actually a concentrated form of tetracycline. Accutane is used for severe acne. Barbiturates will cross the placental barrier. Opiates will cross the placental barrier. Central nervous system depressants, non-steroidal anti-inflammatory drugs such as aspirin, and hormones will cross the placental barrier. Drugs that cross the placental barrier, diazepam, when taken during the last trimester, causes irritability and exaggerated reflexes in the baby. Diazepam, of course, is a sedative. Chloramphenicol causes gray baby syndrome. Chloramphenicol is an antibiotic. Cipro or naroxene causes joint abnormalities. Cipro and naroxene is an antibiotic. Kanamycin may cause deafness. It's also an antibiotic. Macrodantin is also an antibiotic. It causes anemia. Streptomycin, another antibiotic, causes deafness. Sulfonamides taken late in pregnancy may cause jaundice, and that is an antibiotic. Coumadin, which is a blood thinner, leads to bleeding problems in the baby. Carbamazepine, phenobarbital, and phenytoin will cause birth defects. Those are all anti-epileptics. ACE inhibitors, blood pressure medication, late in pregnancy may cause kidney damage to the fetus. Beta blockers, another blood pressure medication, slowed growth due to low heart rate and low sugar. Lithium, which is a treatment for bipolar disorder, may cause heart defects. Aspirin, ibuprofen, or naproxen, these are all analgesics, delayed labor, bleeding problems, heart problems, and jaundice. Chlorpromamide, tolbutamide will cause low blood sugar and birth defects. Those are both medications for type 2 diabetes. Physicians have discovered the effects of some drugs produce some fairly tragic results. Thalidomide was a drug given to women around the world in the 1950s to alleviate symptoms of morning sickness. It caused stunted and missing limbs, severe facial deformities, defective organs. It affected 12,000 babies worldwide. Another surprise to physicians was the synthetic hormone diethylstilbestrol, or DES. It was introduced in the late 40s and early 50s to prevent miscarriages. Unfortunately, as the daughters of mothers who took DES reached puberty, some developed rare forms of vaginal and cervical cancer. Some had a hard time maintaining their pregnancies. Some sons of DES mothers developed testicular cancer, and some were sterile. Since the 1980s, physicians have realized that women who consume alcohol throughout their pregnancy risk causing serious damage to their unborn infant. 1 out of every 750 infants born are born with fetal alcohol syndrome. And this is a picture of the first child they ever diagnosed with fetal alcohol syndrome. That doesn't mean that it didn't happen before. This was in the 1980s. This is the first time they ever recognized it. It was a baby on the one of the reservations in South Dakota. Alcohol affects the fetal brain, changing the structure of the corpus callosum, which affects voluntary movement and higher order processing. 1 in every 75 births is born to a woman who drank moderately, a condition known as fetal alcohol effect. Fetal alcohol effect causes retarded growth, mild intellectual disabilities, delayed emotional development. This is the corpus callosum, and this is the area of the brain that connects the left and right hemispheres. This is depleted in individuals suffering from fetal alcohol syndrome. Fetal alcohol syndrome causes slow prenatal and postnatal growth, facial and bodily malformations, disorders of the central nervous system, poor sucking responses, brainwave abnormalities, sleep disturbances, slow information processing, short attention span, restlessness, irritability, hyperactivity, learning disabilities, retarded growth, and motor impairments. I wonder if you reckon this is a child that has had open heart surgery. This is the same baby. Oops, I'm sorry. This is the same baby as this baby. This is him later on when he had open heart surgery. And these are pictures of children with fetal alcohol syndrome. This is from Germany. And that's what they look like, looking straight on. This is the corpus callosum. These are children with fetal alcohol syndrome. This is a corpus callosum. This is normally what it looks like. This is a normal one. This is a normal one. This is a baby with fetal alcohol syndrome. And this is one where the corpus callosum is almost absent. That's weird. As that may be. The trend in the last 20 years is for men and women to wait longer to marry and for women to delay reproduction until they are in their 30s. Recent research has disclosed that women who do not begin reproduction before the age of 28 are in a greater danger of having chromosomal damage to their ova and greater complications during their pregnancies. The possibility of Down syndrome increases markedly with age and is especially prevalent in women over 40. My own daughter had my grandson when she was 42 years old. So we were watching the pregnancy very closely, and we were quite pleased that my grandson was born with no problems at all. To ensure that the fetus gets adequate vitamins or that the fetus doesn't deplete the mother's stores, the mother should supplement her diet with a multivitamin. 3 items that are essential to good fetal health are iodine, zinc, and the B vitamin folic acid, also known as B9. Iodine prevents cretinism and thyroid problems. Zinc promotes cranial growth and proper weight gain. And folic acid, especially in the first days of fetal development, prevents neural tube defects such as anencephaly and spina bifida. Obese women have a higher risk of giving birth to babies with neural tube defects. They also tend to have greater complications during pregnancy, including miscarriage, stillbirth, neonatal death during the first month of life. Underweight women are more likely to have dangerously small babies. Moderate exercise does not seem to endanger the fetuses of healthy women. In fact, regular exercise can prevent constipation and improve respiration, circulation, muscle tone, and skin elasticity, which will make for an easier delivery and quicker recovery postpartum. It is estimated that nicotine use by pregnant women causes 115,000 miscarriages every year in the United States. And nicotine has been identified as a contributing factor in 5,600 infant deaths a year. 53,000 babies are born underweight every year due to nicotine consumption. Infants of mothers who smoke have higher incidences of respiratory problems, including more colds and asthma. Evidence seems to indicate that smoking during pregnancy may cause poor attention span, hyperactivity, anxiety, learning and behavior problems, perceptual, motor, and linguistic problems, low IQ scores, low grade placement, neurological problems. There is no definitive research to indicate that caffeine causes low birth weight, premature birth, retarded fetal growth, or miscarriage. However, moderate to heavy use, 4 or more cups of coffee a day, may increase the risk of sudden infant death and possibly spontaneous abortion. Marijuana has been shown to cause ovulation abnormalities in women and lower testosterone and sperm counts in men. Pregnant women have higher rates of spontaneous abortion, pregnancy complications, and delivery problems. Marijuana has been linked to a condition known as deranged immune cell factor, leading to childhood cancer. There are higher rates of low birth weight in infants of marijuana smokers and may have such neurological disturbances as tremors and a heightened startle response. Women who use opiates during pregnancy will probably give birth to a baby addicted to the drug. These babies are restless, irritable, have tremors, convulsions, fever, vomiting, breathing difficulties. If these babies survive, they cry often and show severe withdrawal symptoms. If they survive, they will always show developmental delays. And as those of you who have had classes with me before, I had a great niece who was a heroin addict, and she gave birth to a baby that was addicted to heroin. And the baby spent 8 weeks in the hospital. It's alive now, but it has rage issues. Cocaine use during pregnancy can cause higher risks of spontaneous abortion, prematurity, low birth weight, small head size. If the baby survives, they may be less alert, not responsive either emotionally or cognitively, more excitable, more irritable, less able to regulate their sleep patterns. As they grow out of infancy, their lethargy, irritability, and unresponsiveness may prevent the infant from forming a close relationship with their mothers, who may have other problems as well, since she was using cocaine during her pregnancy. The cocaine-addicted child may be marked by excessive activity, muscular tension, exaggerated startle response, tremors, and evident antisocial behavior. As the individual gets older, their neurological problems will most likely improve, but their antisocial behavior probably will not. Sexually transmitted infections tend to have different impact on developing fetuses and newborns because of their structure and ability to cross the placental barrier. Gonorrhea, also known as the clap, is a bacteria that will not cross the placental barrier but can do a great deal of scarring in the reproductive organs of both males and females. If female scarring in the fallopian tube may be so extensive, the zygote is not able to migrate down the tube to the uterus, or the tubes may be blocked completely. In males, scarring can cause impeded sperm flow through the vas deferens to the point of blockage and sterility. Since gonorrhea is often asymptomatic in women, it is possible for a woman to deliver when she is infected with gonorrhea. If the baby passes through the birth canal when the mother is infected with gonorrhea, the baby may become infected as well. The most serious danger is an infection of the eyes, which will cause blindness. For this reason, silver nitrate is placed in the baby's eyes after delivery. Other problems that might affect a baby include heart infections, lung infections, and joint infections. The syphilis bacteria, Treponema pallidum, is able to cross the placental barrier. If the fetus is infected, it may result in premature delivery, stillbirth, or congenital syphilis. Genital herpes is a virus that, if present during delivery, can cause blindness and even death. I saw thousands and thousands of babies. I checked them all for syphilis. I found one. I found one in my entire 30 years of working in the laboratory. AIDS caused by the HIV or HTLV3 virus disrupts the body's immune function. The virus can cross the placental barrier, but can be blocked if select antiviral drugs are taken by the mother during pregnancy. Unfortunately, these drugs are relatively expensive and therefore rarely available in Africa, where the disease continues to devastate the continent. Babies born with the AIDS virus may develop a full-blown disease at any time. Some develop antibodies that destroy the virus before it is allowed to replicate. Despite all the programs in place to assist pregnant women, universal prenatal care still does not always take place. While the national average for women who get late or no prenatal care for all races is 3.9%, for natives the figure is an abysmal 8.6%. Other minorities are also above the national average, including blacks, Mexican Americans, Puerto Ricans, Hawaiians, and Central and South Americans. Up until 21 weeks, the survival rate is almost nil. Almost nobody survives. If the fetus the gestation period is over 22 weeks, the survival rate starts to go up. The youngest, I think, is 19 weeks that they've been able to allow some child to survive. 22 weeks, they have a 0 to 10% survival rate. 23 weeks, 10 to 35% survival rate. 24 weeks, 40 to 70% survival rate. 25 weeks, 50 to 80% survival rate. 26 weeks, 80 to 90% survival rate. 27 weeks, greater than 90% survival rate. Youngest baby to ever survive was born under 20 weeks at the 19th week mark. The first stage of delivery is the longest and typically lasts 12 hours or more. In first children, the first stage is longer and becomes exceedingly shorter the more children a woman has. This stage involves contractions of the uterus, causing the tiny hole in the cervix to expand enough to allow the bulk of the baby to pass through. The second stage of labor typically takes 1.5 hours or less. This stage begins when the baby's head begins to move through the cervix and into the vaginal canal. The stage ends when the baby completely emerges from the mother's body. If this stage lasts longer than 2 hours, the physician may use some form of assistance to extract the infant. The third stage lasts 5 to 30 minutes and involves the placenta and the umbilical cord being expelled from the mother's body. This was previously called passing the afterbirth, but names have been changed to protect the delicacy of people's feelings. The fourth stage involves the recovery process where the baby and the mother both rest and their condition is monitored. Cesarean delivery is a surgical procedure to remove the baby from the uterus by cutting through the abdomen. Cesarean birth rates in the United States are among the highest in the world. Alternative methods of childbirth minimize the use of drugs while maximizing parents' active involvement. This is a horizontal incision. It's known as the bikini cut, and this is the vertical incision. And of course, you can see this scar if someone's wearing a bikini. Complications of childbirth. Birth trauma may be caused by anoxia, oxygen deprivation, diseases, infections, or physical injury. Low birth weight babies fall into two categories, preterm and small for date. A low birth weight baby, if necessary, is placed in an antiseptic, temperature-controlled crib known as an incubator and fed through tubes. 50 years ago, the leading cause of intellectual disabilities in the United States was a condition in some neonates that did not allow them to metabolize protein properly. This condition caused a buildup of phenylketonuria in the blood, which destroyed brain cells. Phenylketonuria is a waste product of protein metabolism. Now, by screening all babies at birth, phenylketonurics can be placed on a special diet and live otherwise normal lives. Hypothyroidism and galactosemia, also known as maple syrup disease, are also screened at birth in most states. I was working at the hospital at a hospital in Omaha. This time I was working at St. Joseph, and I went into the nursery. They had a huge nursery. That's where most of the babies were born in Omaha. I went into the nursery and I smelled pancakes, and I said to one of the nurses, "Is somebody eating pancakes? I can smell pancakes." And the lady got real upset and accused me of accusing them of eating in the nursery. And I went to draw this baby's blood, and by golly, that baby smelled like maple syrup. And I told the lady, "This baby smells like pancakes." And of course, she got mad and she left. And when she came back, she came over to the baby and she smelled it too. The problem was, of course, you're working in a nursery and all the babies are peeing and pooping all the time. And your nose gets filled with this odor and you stop smelling things. I was a lab tech. I was going in to draw blood. And because I hadn't been there, I smelled what was there. They were trying to block the smells, of course. And I noticed that the baby had smelled like pancakes. And of course, the baby had galactosemia. We were able to treat the baby, no problems. But the nurses had all missed it because they were around all those smells all the time, and they just blocked it. Didn't even think about the fact that the baby smelled like maple syrup or pancakes, as I said. Infant mortality in selected countries of the world in 1990 and 2001, 2006 for Iceland, 2004, 2005 in other countries. And here we go. Where's the United States? We're way down here. See, Iceland's way up here. So they don't have the same problems that we have. We're way down here, and that's because of our healthcare system. We don't have universal health care in the United States. We're getting better with the Affordable Care Act, and with Medicaid, but it's just not it isn't what it should be. And so we're way down here. Here's all of these countries in the world that have a lower infant mortality rate: Iceland, Japan, Sweden, Norway, Finland, Germany, Slovenia, Spain, France, Netherlands, Denmark, Belgium, Ireland, the UK, and then there is us, and we're way down here. The only people below us are Russia, Ukraine, Latvia, Lithuania, and Poland. Highest infant mortality, of course, are countries in Africa. These are all African countries. This is an Asian, Afghanistan, of course, is an Asian country. Other than that, these are all African countries. Infant mortality rates, these are the lowest ones: Austria, Belgium, Finland. Iceland's not there, of course. But these have infant mortality rates that are 3 and 4. The United States has 7. Sierra Leone has 161. So, there you go. Anyway, okay, so kind of an ugly chapter. I apologize for that. Next week we'll grow this kid up a little bit more, okay? So I'll talk to you next week.